Mr. Gardner, I'd like to see how well you do certain movements. Pat your
Begin
hands on
by
your knees
testing
and
rapid
alternate
rhythmic
between the
alternating
palms and the
movements
backs of
with
your
the
hands.
patient seated.
And a little faster.
The movements should be smooth and
And now as
rhythmic,
fast as you
even as
can.
the speed increases.
Touch your thumbs
As an
to each of your
alternative,
fingers.
have the patient touch his thumb to each finger on the same hand, from the index finger to the little
Now a
finger
little
and
faster.
back. There should be no stiff, slow, or
And now as
uncoordinated
fast
movements.
as you can. Very good, Mr.
Next,
Gardner.
test
Now I'd like to
accuracy of
try another
movements,
test. Take your
beginning
right
with the
index
finger-to-finger
and touch your
test.
nose. Now touch my finger.
The patient's movements
nose.
should be rapid, smooth, and accurate, with no past pointing. Next,
Good.
perform the finger-to-nose test.
Now for this next test, take your arms out to their sides, close your eyes, and touch your nose with one index finger and then the other.
These movements also should be rapid, smooth, and accurate, even with increasing
And
speed.
now a little faster. And now as fast as you can. Good.
Would you like to meet Mr. Bear? Can you touch his nose? Good. Let's play a game and see if you can catch Mr. Bear. Good.
To test accuracy of movements in a young child, observe her ability to reach for, grasp, and release a toy.
Great.
You should
good at
see
this
no
game.
tremors or overshooting movements.
Now I'd like to test your leg movements. Take your
Now
right
perform the
and
heel
run
to
it up
shin
your left
test,
shin up
which
to
may
your
be
knee,
done with the
and then
patient
back down
seated,
again.
standing, or supine. The patient should move his heel in a straight line, without deviations to the side.
I'd like you to stand
To
with your
assess
feet
the
together
patient's
and your arms
balance,
at your side.
use equilibrium tests, such as the Romberg test. Slight
Good.
swaying is
Now
expected,
close your eyes.
but stand nearby in case the patient starts to fall. If you see staggering or loss of
Now open
balance,
your eyes.
delay the other balance tests.
I'd like you to stand with your feet shoulder width apart. Keep your eyes open. I'm going to give you a slight push.
Your push should throw the patient slightly off balance, but he should recover his balance
Now
quickly.
close your eyes. Stand on your right foot and keep your arms at your sides.
To continue, have the patient stand on one foot, with his eyes closed and arms at his sides.
Now the left.
He should maintain his balance for 5 seconds, although slight swaying is expected.
Now open your eyes. Try hopping on your right.
Also, have the patient hop in place on one foot with his eyes open.
Now try
He
your
should be
left.
able to hop for 5 seconds on each foot without losing his balance.
Now I'd like to see how well you walk.
Now
Please go to
evaluate the
far
patient's
wall
gait.
and back.
The gait should have a smooth, regular rhythm and symmetric stride.
Good. Now I'd like you to try the same thing with your eyes closed. I'll tell you when to turn around.
The patient's legs should move easily between the stance and swing phases, and his arms should swing smoothly and symmetrically.
Stop.
Because proprioception decreases with age, an older patient may have short, uncertain steps and a shuffling gait.
We have one more walking test to do.
Okay.
This time, when you walk to the wall, touch your heel to your opposite toe, like this.
To exaggerate
Your
any
eyes open and your
unusual
arms
gait,
at your side.
check heel-toe walking. As the patient walks, you should see consistent contact between the heel and toe, as well as good balance.
Now do the same thing backwards.
The patient may sway slightly, but should not stagger, reel, or fall.
Good, you can stop. Okay, Mr. Gardner. Now have a seat on the table.
Next, begin testing sensory function in the hands, lower
I'll
arms,
help you lower your
feet,
gown to your
lower
waist
legs,
so that we
and
can test
abdomen.
your sensory function.
When testing sensory function, expect to find minimal differences bilaterally, accurate interpretation of sensations such as hot or cold, correct discrimination of the side of the body tested, and accurate location of sensations. To test primary sensory functions, begin
Mr.
by
Gardner.
assessing
For these
superficial
next
touch.
tests, I'm going to need you to close your eyes. I'll demonstrate each test before I do it. I'm going to touch your skin with a cotton wisp, like this. I'll need you to point to each place where you were touched.
Okay.
Go ahead and close your eyes.
Be sure to use a light touch and avoid stroking areas with hair. Because this test also assesses point location, note whether the patient has any difficulty localizing the stimulus, which should not be a problem. Next, assess superficial pain.
Okay, Mr. Gardner. I'm going to touch you with this broken tongue blade. I'm going to need you to tell me whether it feels sharp like this or dull like this. And point to the place where you were touched. Go ahead and close your eyes.
Sharp.
Apply the sharp and dull stimuli randomly, allowing 2 seconds between stimuli to avoid a summative effect. Wherever you use a dull touch, also use a sharp touch, because the dull stimulus is the control.
Dull.
This is hot, and this is cold. Let me know which one you feel and where you feel it.
If superficial pain
Go ahead and close
sensation
your
is
eyes.
impaired, assess temperature and deep pressure sensations.
Hot.
For temperature, roll test tubes of hot and cold water against the patient's skin and have him identify the temperature and
Cold.
location.
Hot.
Tell me what this feels like.
To evaluate deep pressure, squeeze the
squeezing kind of
patient's
pressure.
trapezius, biceps, or
Now?
calf muscle.
The same.
This should cause discomfort.
Now,
Also the same.
I'm going to touch you with
Continue
this
by
vibrating
testing
finger
vibration.
in a few bony areas. Please tell me when and where you feel it.
Okay.
Go ahead and close your eyes.
Begin testing at the most distal joints and move to
Now, left
proximal
toe.
ones. Occasionally dampen the tines
Now,
to
my
see if
left
the
ankle.
patient notices the difference.
Now, my right knee, but it doesn't feel the same. It's not vibrating.
Next, check joint position sensation.
Now I'm going to raise your toe up like this or down like this. I'd like you to tell me whether it's up or down.
Okay.
Go ahead and close your eyes.
Remember to hold the joint by the sides, return it to a neutral position
Down.
after each movement, and assess the great toe of each foot and one finger on each
Down.
hand.
Down.
Now I'm going to place an object in your hand. I'd like you to feel it and tell me what it is.
Okay.
Go ahead and close
To
your
test
eyes.
cortical sensory functions, start by assessing stereognosis. Through touch and manipulation, the patient should be able to identify the
It's a
object.
coin. Feels like a quarter, maybe?
Next, assess 2-point discrimination.
Now I'm going to touch you with 1 point like this or 2 points like this. I'd like you to tell me how many points you feel.
Okay.
Go ahead and close your eyes.
Using a paperclip or sterile needles, perform this test in various locations, noting the distance at which the patient can no longer distinguish 2 points. This distance varies greatly, for example from 2 to 8 millimeters on the fingertips to 40 millimeters on the forearms.
1.
Now test for the
Thank you,
extinction
Mr. Gardner.
phenomenon.
That was very good. This time, I'd like you to point where you were touched.
Using the paper clips or same sterile needles, simultaneously touch the cheeks, hands, and other areas on each side of the body. The patient should report bilateral sensations. For the next assessment, check
I'm going to
graphesthesia.
draw a letter or a number in your hand. I'd like you to tell me which one it is.
Okay.
Go ahead and close your eyes.
A literate patient should be able to recognize your letters and numbers easily on both hands.
8.
Good.
A.
Good.
I'm going to draw a shape in your hand.
For a young child, adjust this test slightly.
This is an X.
Instead of numbers or letters,
Close your eyes,
use
and I want you to
geometric
tell me if I'm
shapes.
drawing two
Draw them
different shapes
twice
or
in the
same.
child's hand. Then ask him whether the shapes are the same or different.
Different shapes.
Different shapes? Good. Let me try your other hand.
Now turn your attention to reflexes.
I'm going to test your abdominal reflexes now. Just
With
try
the
and relax.
patient supine, test his superficial reflexes.
Now I'm going to tap on some of your tendons and test the rest of your reflexes.
Okay.
I'll help you sit up.
Finally, evaluate deep tendon reflexes with the patient seated or supine. Because eliciting these reflexes can be challenging, follow these tips. Have the patient relax and focus on other muscle contractions, such as pulling his clenched hands apart. Put slight tension on the tendon to be tapped. Palpate the tendon to locate the right spot to tap. Hold the reflex hammer loosely. Tap the tendon briskly, and compare sides, which should have symmetric responses. Also, score each deep tendon reflex with a 0 for no response, 1+ for a sluggish or diminished response, 2+ for an active or expected response, 3+ for a brisker than expected or slightly hyperactive response, or 4+ for a brisk hyperactive response with intermittent clonus.
I'm going
To
to test
assess
the
the
reflex of your
biceps
elbow
reflex,
first.
bend the patient's arm to 45 degrees at the elbow. Place your fingers under the elbow and your thumb over the tendon. Strike your thumb with the reflex hammer. You should see or feel elbow flexion.
Now I'm going to test the reflexes in your forearm.
Okay.
For the brachioradial reflex, bend the patient's arm to 45 degrees and rest his forearm on yours with his hand slightly pronated. Strike the brachioradial tendon directly. Forearm pronation and elbow flexion should occur.
Now I'm going to test the reflexes at the back of your elbow.
Okay.
To elicit the triceps reflex, hold the patient's arm with the elbow flexed to 90 degrees. Just above the elbow, strike the triceps tendon. There should be visible or palpable elbow extension.
While I check your knee
With the
reflexes,
patient's
I'd like you
knees
to
flexed
clench
to
your
90
hands and
degrees,
try and pull them
test the
apart.
patellar reflex. Support the upper leg with your hand so that the lower leg hangs loosely. Just below the patella, strike the patellar tendon. Watch for lower leg extension.
Keep trying to pull your
With the
hands
patient's
apart
knee
while I
flexed
check
to
your
90
ankle
degrees,
reflexes.
assess the Achilles reflex. Hold his heel so that the ankle is in a neutral position. At the level of the malleoli, strike the Achilles tendon. The foot should plantar flex in response.
Okay, if you could just relax.
Because of age-related changes in deep tendon reflexes, expect an older adult to have diminished responses, especially in the legs.
There's one more test I have to do on your feet and ankles.
Okay.
Last of all, test for ankle clonus. With one hand, hold the patient's leg with the knee flexed and in a relaxed position. With the other hand, sharply dorsiflex the foot once or twice and hold it there. You should not feel any rhythmic oscillations between dorsiflexion and plantar flexion. Assessment of motor and sensory functions and reflexes is only part of the neurologic examination, yet it can tell you a lot about the patient's nervous system. Together with findings from the mental status and cranial nerve examination, and the patient's health history and laboratory test data, these findings can give you a complete overview of the patient's neurologic health.